Today, going for gorgeous. Why do we spend millions of dollars on cosmetic surgery every year in our country and across the world? Why do we have concerns for how we look? Why do we spend more in beauty parlors and on pedicures and manicures than on sometimes things that we actually need? What's going on with this? Well, you know as well as I do, it's all about aesthetics. Parents and children are more concerned about aesthetics than they are about function. They are not concerned about sealants. They're not concerned about decay. Not really. They're not concerned about your restorative treatment plan. They're concerned about how pretty their child looks. They will take the child, a little girl, a 5-year-old, 4-year-old, even 3-year-old, for a mani-pedi. And for you guys who don't know what that is, that's a manicure and pedicure for a 3-year-old before they will come and have you take care of a cavity in that child's mouth. Well, let me say, if the cavity is in the front and they can see it, maybe they'll come and have that fixed. Maybe, right? So why are they concerned more about the aesthetics than the function? Isn't that an interesting conundrum? Well, I can tell you why. Because as Nancy Etkoff's book that she published years back, she teaches at Harvard, says, it's survival of the prettiest. Indeed, attractive people get better grades in school. Attractive people get better jobs. Attractive people get better partners in life who make more money, who have more education. They have more opportunities for the jobs themselves. Think about who you would hire and who you might not. Attractive people have higher IQs. Yes, it's all in the literature. Attractive people get off the hook easier when they commit crimes. In fact, one of the biggest problems we have is that a beautiful person with a criminal mind and criminal behavior is likely to repeat and repeat and repeat because they're beautiful. And they are looked at as, maybe they'll do better next time. Attractiveness sells. That's what the ads are about. That's what marketing is about. Attractiveness is what we want. Patients come in and they want you to do orthodontics. Why? So they can have better function? Nope. So they can be more attractive. And you know what? If patients and parents are more concerned about beauty, about aesthetics in the orthodontics than function, perhaps they're right, having thought about what I just said that attractiveness can do for someone. Yeah? So, what that brings us to is that orthodontics is a beauty treatment. We are going for gorgeous. If it's a toss-up between doing her roots or buying a dress, and think about what's going to happen. She's going to get her hair done before you can blink, as I read in a very cute story called Isle of Palms by Dorothea Benton Frank. And the point is, it's true. A woman is going to take care of beauty needs as perceived by her and probably as perceived by others before anything that even possibly painful things, painful teeth. And, you know, as Dorothea Benton Frank went on to say, when you find a hairdresser you like, you stick with them, as she said, like white on rice. Aesthetics sells. Now, this is not a prescription for mistreating people. This is not a prescription for in any way judging people. The reality is it's a prescription for how you can help in a whole new way with a whole new understanding of what your patients want. Why would they go for veneers and cosmetic dentistry, which has become so popular and much more profitable in the last years? Why? Because they all want their teeth to be just as white as that rice, just as white as that paper, just as beautiful. Aesthetics is so important. Now, I wrote down several, let me read you several quotes from the 2002 report of the Surgeon General, which was on oral health. This is an amazing thing to think about. The importance of the face as the bearer of identity, character, intelligence, and beauty is universal. We all feel that way all over the world, cross cultures, cross genders, cross people, cross everything. Now, it goes on to say, faces judged ugly or disharmonious, or those marred or scarred by birth defects or injury, listen to this, have been associated with defects in character, in intelligence, and in morals. Remember, I told you the attractive criminal gets off easier. Well, the unattractive, maybe not even criminal, gets judged and accused easier. That's a wow. People are right. Now, one more, and I want to close with this thought for you so that you really understand what's going on with your patients and why orthodontics. Well, let's stop for a minute before I even do that. Why do they come in and want orthodontics from you? And they don't even want the dentistry. And we're answering that as we go. Listen to this. If there is a defect on the sole, it cannot be corrected on the face. But if there's a defect on the face and one corrects it, it can correct a sole. Jean Cocteau said that many years ago. Is it any wonder that your patients want you to do their ortho? And you can get such incredible pleasure and satisfaction in doing it. We're going for gorgeous, doctor. Good day.